Whenever you're ready, guys.
Hello, I'm Dr. Lorne.
Dr. Darryl, Barry Chiropractic and Health Service Center.
Today what we're going to do is we're going to show you, we've introduced a couple of chairs into each of the rooms. And these are called wobble chairs. There's two separate ones. They are very similar. Couple different aspects of them. But wobble chairs, what they've shown in research, really help rehydrate the disc. So the first stage of degeneration is that the disc starts to dehydrate. So this is going to help and get those nutrients back to the disc. It also strengthens the core muscles, which again is very important for the spine. It also stretches muscles and it also increases mobility, which makes it easier when we adjust if there's more movement in the spine already. So we ask that when you're sitting in the waiting room, we feel it's always better to do something to improve your situation. And so we've always said, let's do something while you're waiting for us to get into the room. So we'd ask that you do some wobble exercises, some wobble chair exercises. These are fantastic, but there is a safety aspect to it. They wobble in all different ways. So it's very important that you're going to sit on them properly. And I'm going to let Dr. Darryl show you how to use these.
Excellent. Okay, so as you can see, there's two tables, they're chairs, they're very similar. And I'll just show you. The principle is similar to an exercise ball. A lot of you heard about exercise balls. The difference is that the fulcrum on the chair is a lot smaller, so it will wobble a lot more aggressively. So if you look, you can see that the seat kind of moves around. Same with this one over here. This one, you want the point of the chair pointing forward. There's arms on that chair, there's arms on this chair. So what you're going to do is you're going to do this very carefully. Put your arms on the chair first so that you're stable, and then sit down. And we'd encourage you to keep your arms on the armrests until you get pretty comfortable doing this. So the first thing you're going to do is you're just going to wobble side to side. So what you're doing is you're moving that spine side to side. And for some of you, you'll notice maybe it's a bit uncomfortable as you get to the outside and one side and then the other. But as you continue to do it, it starts to get a little bit easier. So wobble away until it starts to feel a little bit better. The next activity would be to go forwards and backwards. And the objective here is that you're trying to scoop the pelvis more or less back and forth, wobbling it back and forth. That one's not that hard. The next one to do would be circles. So if you can go in a circular manner a few times. For me, I can feel a little bit of a pinch as I go to that side, and as I continue to do it, it kind of loosens up, and that's the whole idea. We're trying to get little adhesions within those joints to let go, which theoretically will make it easier for us to do an adjustment with you later. If you can master going one way and then the other with the circles, if you're really good, you can actually do figure eights with your pelvis, which is a lot more challenging. And of course, the next step would be to do that without any hands, but be very careful because as soon as you let go, you're kind of on your own. You do want to maintain both feet on the ground. I don't expect anybody to do with any feet on the ground. And as I said, this chair is very similar. It just looks a little bit different. Okay, so yeah, that's as Lorne said, something that we can do while we're in those adjusting rooms waiting for us. We hope you take advantage of them. We do think that they're helpful. So wobble away. Thanks for being part of our practice.
Thanks a lot.